Do hair loss shampoos actually make a meaningful difference? Or are the claims on the packaging more impressive than the results? That's a fair question. And the honest answer is it depends entirely on what's causing your hair loss in the first place. Hair loss is incredibly common. It affects men and women of all ages, and there are several different causes. The most common is androgenetic alopecia, what most people call male pattern or female pattern baldness, driven by genetics and a hormone called DHT. But hair loss can also be caused by telogen effluvium, a temporary shedding triggered by stress, illness, or hormonal changes like postpartum hair loss. Other causes include alopecia areata, an autoimmune condition causing patchy loss, scalp conditions like seborrheic dermatitis or psoriasis, nutritional deficiencies, and thyroid disorders. The reason this matters is simple. The right approach for one cause may be completely wrong for another. So let's talk about what the evidence actually says. Of all the shampoo ingredients available in the UK, ketoconazole has the most peer-reviewed clinical evidence behind it. Research suggests it can support scalp health and hair density, particularly in androgenetic alopecia and seborrheic dermatitis, by targeting the fungal and inflammatory factors that can contribute to scalp disruption and hair thinning. That said, it's worth understanding something important about all shampoos. Because they're rinse-off products, their impact is generally more modest compared with leave-on treatments. Active ingredients simply have less contact time with the scalp. You may also have seen shampoos containing caffeine, biotin, or saw palmetto. These are widely marketed, but the clinical evidence behind them is currently limited or preliminary. On biotin specifically, supplementation is generally only helpful if you have a confirmed deficiency, and it's worth knowing that taking biotin supplements can interfere with certain blood tests, including thyroid and troponin tests. Always let your doctor know before any blood work. It's also worth understanding how these products are regulated. Most hair loss shampoos in the UK are classified as cosmetics, not medicines. That means efficacy claims on the packaging aren't held to the same standard as MHRA licensed treatments. So when a shampoo promises to reduce hair loss or boost growth, that claim hasn't necessarily gone through the same rigorous process as a licensed medicine, and it's worth keeping that in mind. Speaking of licensed treatments, if you have androgenetic alopecia, there are MHRA-approved options that are more clinically established than any shampoo. Topical minoxidil is available for both men and women. Oral finasteride is a prescription-only option for men. These are worth discussing with your doctor if you're looking for treatments with a stronger evidence base. So what should you actually discuss with your healthcare professional? A few things are worth raising. First, ask about identifying the underlying cause of your hair loss. Without that, it's difficult to choose the right approach. If a medicated ketoconazole shampoo seems appropriate for your situation, ask whether it's suitable for you and how to use it safely as directed. If you've been taking biotin supplements, mention that before any blood tests. And if you're interested in licensed treatments like minoxidil, that's absolutely a conversation worth having. There are also certain types of hair loss that need prompt medical attention rather than a shampoo. See your GP if your hair loss is sudden, patchy, or inflamed, or if it's accompanied by symptoms like fatigue or weight changes. These could point to a thyroid issue or another underlying condition. Tinea capitis, a fungal scalp infection mainly affecting children, needs systemic antifungal treatment and early assessment to prevent transmission and scarring. And scarring alopecias are where the follicle itself is being permanently damaged, require expedited referral to a dermatologist, as delayed treatment can cause irreversible loss. To recap, ketoconazole shampoo has the strongest clinical evidence of any shampoo ingredient for scalp health. Most hair loss shampoos are regulated as cosmetics, so treat marketing claims with healthy skepticism. And for androgenetic alopecia, licensed treatments like topical minoxidil are more clinically established than shampoos alone. Please do speak to a healthcare professional before starting any new treatment. They can help identify what's actually driving your hair loss and recommend the most appropriate approach for you. If you found this helpful, leave a comment below. We'd love to know what topics you'd like us to cover next. And if you haven't already, Please give this video a like and subscribe to the Bulk Pharmacy channel for more evidence-based health content.